The current definition of obesity uses BMI to define obesity class. Obesity class based on body mass index, which is calculated from height and weight, essentially tells you how big your patient is. It does not necessarily tell you how sick your patient is. The Edmonton Obesity Staging System, which looks at medical health problems, mental health, but also at functional health and well-being, is a much better system that allows you to understand how obesity is actually affecting the health of your patient. So for example, when we look at stage 0, we're talking about a patient who meets the BMI criteria of obesity, but has no apparent obesity-related risk factors. Their blood pressure is normal, their serum lipids and fasting glucose are within the normal range, they don't have physical symptoms, there's no psychopathology, and they don't have functional limitations or impairment of their well-being. When we look at stage 1 patients, these are individuals who have obesity-related subclinical risk factors like borderline hypertension or impaired fasting glucose. These patients can present with mild physical symptoms like dyspnea on moderate exertion. They may have occasional aches and pains or some fatigue. These patients can also present with mild psychopathology or mild functional impairments of their well-being. For stage 1 patients, you would certainly want to investigate them for other non-weight related contributors to their risk factors. And these are also patients where you would consider intense lifestyle interventions, including diet and exercise, focused on preventing further weight gain. It is also important in these patients to monitor and address those risk factors and improve their general health and well-being. When it comes to stage 2 obesity, we're now looking at patients who have established obesity-related chronic disease like hypertension, type 2 diabetes, sleep apnea, osteoarthritis, reflux disease, polycystic ovary syndrome, and other health problems. These are also individuals who present with more moderate limitations in their activities of daily living or well-being. For the stage 2 patient, we have a clear indication to start obesity treatments, including considering all of the behavioral, pharmacological, and surgical treatment options. For stage 2 patients, it is essential that we closely monitor and also manage their comorbidities as indicated. Patients with stage 3 obesity, in addition to having obesity-related chronic disease, are now presenting with established end organ damage such as myocardial infarction, heart failure, diabetic complications, severe osteoarthritis, or with significant psychopathology that leads to functional limitations and severe impairment of their well-being. For these stage 3 patients, management will include intensive obesity treatment, again including all of the behavioral, pharmacological, and surgical treatment options. We would certainly also be looking at aggressive management of comorbidities as indicated. Finally, for the stage 4 obese patient, we're looking at someone who has severe end-stage disabilities from their obesity. They have severe related chronic diseases, they have severe disabling psychopathology, and severe functional limitations and impairment of their well-being. These are the kind of patients for whom you would either consider aggressive management of their obesity as deemed feasible, or you would consider palliative measures, including pain management, occupational therapy, and psychosocial support.